welcome. We are recording today on November 19th, 2020, and the subject for today's the subject for our talk today is looking at how one can use a health savings account to help cover the cost of a membership in a direct patient care practice. And also, I'd like to talk a little bit about COVID and COVID updates for the holidays and how to stay safe with your family. So, well, thanks you all for joining us. I am eager to be able to share some information because this is enrollment time as people re-up on their health insurance plans for the new year. And there's a lot of good information and a lot of questions about concierge practices and how the finances work. So I'd like to dispel some of those myths today. In our practice, I am considered out of network with each insurance company. However, I am fully able to offer care to anyone who needs it. We have patients join a yearly annual membership, and once the membership has been joined, then there are no additional charges for copays and deductibles for each individual visit. It's all included in the membership per year. So with open enrollment season upon us, I would encourage people to consider if they have the option of looking at a health savings account or a flex savings account with a higher deductible plan. That type of situation works really well in independent practice models and can really help you to make the most of the healthcare dollars that you're spending. So anyone whose employer offers it is eligible for a health savings account. And the difference between the two, the flex spending account and the health savings account, is related to the dollar amount that you can put into those accounts as well as how those accounts are managed. So a flexible spending account has a contribution of $2,750 annually, which can be set aside tax-free and used throughout the year for any additional health care expenses. So copays and deductibles and supplies that you might need from the pharmacy, prescription costs, additional testing charges, those sorts of things can all be covered with a flex spending account. The key with the flex spending account is that you need to use up the amount that you put into it before the end of the year. Then there's also a health savings account, and those are a little bit different. Those are like actual savings accounts, and they carry on and on. The flex spending accounts actually end at the end of the year, and you must re-enroll each year. And if you happen to leave your job before the end of the year, you may lose those funds that are in a flex spending account. Whereas a health savings account, that money is yours to keep. And the amount that you can contribute for 2021 is $3,600. And if you're a couple filing jointly, you can contribute up to $7,200 annually for the year 2021 into a health savings account. And those dollars can be used for all the same things that a flex spending account can be used for. And one of the advantages with a health savings account, well, a membership fee specifically cannot directly be paid out of a health savings account. If you receive an itemized list of costs for your annual exam from our practice, then that itemized list can be submitted, and health savings account dollars can be used to cover the cost. And also, if you do any additional tests, things like the COVID testing or any additional expenses that come up in the practice, those can also health savings account dollars can be used to pay for those. So I know I get a lot of questions about this in the practice, and I thought it might be interesting for you all to understand what that distinction is, because it definitely takes a minute to wrap your brain around this type of model. People say to me, well, I'm already paying for insurance. How does this work? And we always encourage people to continue to use their own insurance accounts. for the rest of their healthcare needs, because a membership in a concierge practice really just covers the time that you're in the practice and the time that you spend with your primary care physician in that setting, and with whatever other services are included in the membership. So that health insurance is really important to cover specialty costs, the costs of testing, and also if you're ever, require hospitalization. So that's a little bit about those accounts. They might be worth exploring if you work for someone who is able to offer that. Then that's something that might be beneficial for you. So, all right. The next topic that I'd like to talk about today is to go ahead and talk a little bit. I'm sorry. Here's a question. Let me try to answer this question. Would you recommend a high deductible to complement concierge care? Well, I think if you sign up for a health savings account, by definition, those programs are available when you do have a high deductible plan. When they say high deductible, that just means that the deductible has to be $1,350 or higher in order for you to qualify for the health savings account. So that is, but that really works well with this system because you're not going to incur a lot of deductible type charges. Preventive care is covered, and any time office visits in the practice are already covered. So you're not going to have a lot of expenses that hit your deductible. So a high deductible plan, if you're relatively healthy, might be a really good idea. So everybody's situation is different, and it's important to take a look at what your spending has been on healthcare in the year or two or several years prior to the current year, just to get a sense for what the trends are. But I think that those, it's certainly a combination that my patients find really help to defray expenses, so that in the end they actually end up saving money using this system over using a regular plan with a deductible. So, all right. So the next thing I'd like to cover is that just to let everybody know that in our practice we have just received our test kits for rapid PCR testing. So we now have the capacity to offer same-day turnaround times on PCR tests. And this is helpful if you feel that you may have been exposed, if you're experiencing symptoms and you're eager to find out today whether or not you have COVID-19. We have the rapid antigen test available, and we also have the gold standard PCR test, which is sent off to the lab. As the number of cases in the country grows, what we've seen is that the length of time that it takes to turn around that PCR testing has gone up. So they used to be right at 48 hours. Now they're saying 2 to 4 days for test results. And as more and more cases come out, that length of time may actually grow. I've talked with people who've said that it's taken up to a week to get test results in the past. So this is a movable feast for the PCR test through the lab. So in that case, rapid antigen testing may be helpful. So we have rapid antigen testing and rapid PCR testing available in the practice, and you can go to my website and see some more information about what those look like and what the costs are. What is the difference between a rapid PCR test and a rapid antigen test? That's a great question. And it has to do with how the test is processed. A PCR test is a molecular test, so it's looking for specific particles of the COVID-19. It's a RNA test. It's looking at the genetic makeup. And therefore tends to be much more sensitive and just a higher quality test. The rapid antigen tests are more like a flu test that you might take in a regular primary care office, or a rapid strep test where you're looking, it's sort of a quick and dirty assessment of the situation, but it might miss positive results, and there may be what we call a false negative test, where the result comes out negative even when the person has the disease. And so Because of that, with the rapid antigen tests, it's a great screening test, but if you have symptoms or if you have a high probability of having COVID-19, that rapid antigen test might miss some of those patients. So when there's a moderate or a high probability that that test is going to be positive, we're following the Hopkins protocol and following it up with the laboratory-based PCR test as well. The rapid PCR test is a development that people are watching closely, because it obviously would be wonderful for all of us if you could get a very quick, accurate, affordable test for COVID-19, because I firmly believe that the more testing is available, the more accurate testing is available, the better off we'll be, the more quickly we're able to keep a lid on the pandemic and able to return to our usual activities. So the rapid PCR is a better test than the rapid antigen. It's more expensive as a result, but again, it's, the place where it falls down is if with people who have a very low viral load. So it might not be the world's best screening test to detect cases of COVID-19. And certainly what we recommend after rapid testing, where the sensitivity appears to be somewhere around 90-92% on the rapid PCR. If you develop symptoms of any type that could be COVID-related, or if it has not been an appropriate window of time since a direct exposure, you still need to stay vigilant, still need to quarantine, still need to keep an eye on things until we know for certain that you're in the clear. And this is a really important thing to know about tests in general. These tests really are most effective in conjunction with quarantining. So just because if you happen to be with somebody who you find you were with them 3 or 4 days ago and you find out that they tested positive and you just found out yesterday or this morning, we hear this a lot, really the window of time that should pass before you get tested is 3 or 4 days. It's going to take that long for a test to turn, for these types of tests to be effective. And then you still are going to want to be very cautious, because there's still the possibility that that test only captures a snapshot in time, and that it may be that you've been exposed but that you don't have enough of the virus in your system yet to turn the test positive. So we recommend using them wisely, and that's the reason why we always request a consultation before we do the test, because we want to be certain that we're ordering the correct test and that we're really helping you as you're making your decisions about your day-to-day life. So, how to stay safe during the holidays. We're all hearing a lot about this now, especially as COVID-19 cases are just surging around the country. Pretty much every state is now kind of in free fall with new cases developing. In some states it's gotten really bad, where as much as 60 or 70% of the tests that are being run are turning positive. We've reached 55.5 million cases globally for this, and over 11 million cases in the country. And one of the most concerning statistics for a lot of people is that, to get from 0 cases to 1 million COVID cases in the United States took 96 days. The most recent round, going from 10 million cases up to 11 million cases, took 7 days. So we are going to continue to see COVID cases rise. The next couple of months will be daunting ones for the United States. So I would recommend that you do everything in your power to stay safe, to keep you and your family protected. Catching COVID-19 is kind of like, I like the analogy I heard recently was of a block of Swiss cheese. If you have Swiss cheese and you have lots of slices of Swiss cheese, it would take a lot for all the holes in Swiss cheese to line up for you to get, to stand on one side of the cheese and get all the way through to the other side, with, having the infection. So if you think about it, each one of these measures that we can take to protect ourselves is like adding another layer of it's another slice in that block of Swiss cheese, and makes it harder for the virus to go all the way through. And so the things that we want to think about are the same things that we've been talking about and thinking about all along. Wear a face covering. Social distance, 6 feet is good, 10 feet is better. Spend as much of your social time outside as you can, so that there's less likelihood of contraction of the virus. And that's tough in the wintertime, and that's why we see the cases go up. You want to avoid large gatherings, and make serious decisions about what you want to do for the holidays. If you usually have a huge family gathering for Thanksgiving, this may not be the year to do that. It might make sense to approach things virtually and to be in that environment where you're with your family, but you're connected virtually as opposed to being there in person. And if you are traveling and you want to make that trip to see your family, if you're going for Thanksgiving, you should be in quarantine now prior to your departure. And you should consider getting tested before you go and after you return from your travel. So we're all in this together. We're all experiencing these types of situations and making these kinds of decisions. And it's going to be really important that we look out for ourselves and look out for one another. So, what questions do you all have? Is there anything else that we can, that I can address for you today about COVID-19? Let's see. Here's the question: are we in the second wave, and is that why there is a surge in cases? Yes. In fact, we are, now the state of Virginia is doing fairly well right now, at least compared to some of the other states around the country. But we are definitely seeing a steady increase. Our positive case rate right now is just at about hovering around 8%. That means the number of tests that turn back positive. The World Health Organization recommends that we be below 5% before really routine activities return. So, but in other parts of the country, not very far from us, that percent positive rate is much, much higher. For example, Pennsylvania, where there was a lot of activity during the recent election cycle, and a lot of gatherings on both sides with political activism, their positive rate is about 23% for the last 2 weeks. So I would be very careful about traveling to some of these other states at this time. So the country itself is actually having its third wave, but where we are here, it really is it's mostly the second wave, and cases are rising all over the country. And part of the problem is that as the weather turns cold, people spend much more time indoors, and it's just much easier to spread the virus inside. So as much as you can, do your socializing outside, even if it's cold. Sleeping bags, ponchos, polar, heaters on the back porch, all of those sorts of things are very important. And, it's going to be an adventure for everybody. So, let's see. One other question here. How quickly do you think we'll get a vaccine? Yes, that's a great question. And of course, there's been a lot of exciting development regarding vaccines recently. In the last week or so, we've heard very exciting news from at least 2 major pharmaceutical companies about the effectiveness of the vaccines. The final stage trials have been underway and are being analyzed, and the data looks really good, upwards of 90% efficacy for these vaccines. And They're working very hard on a distribution plan. Of course, the next step will be to ramp up the production of the vaccine and then figure out how to get it distributed to whom and where and when. And all of those decisions and actions will take a lot of time. But it certainly seems as though we may have accessibility to a vaccine, at least for some populations, starting as soon as the first quarter or second quarter of 2021. How long before everybody in the country who wants a vaccine will get one? That is to be determined, but we're hoping that it will be by the end of 2021. So, are you worried about a twindemic with the flu? Yes. I think one of the most important steps that you can take right now is to get your flu shot while they're still available, because the biggest concern is that as people become ill, when they fall ill, if they happen to get sicker than they think they're going to, they end up hospitalized, either with flu or COVID-19. Our hospital resources are going to shrink. We are already reaching capacity for ICU beds in a number of states around the country. Here in Virginia, our hospital capacity, when I checked this morning, is our ICU bed capacity. We're at about 65% full, which isn't bad, but there are definitely going to be more cases and more full hospitals in the future. So do everything you can to protect yourself. You know, a flu vaccine not only helps you, but it helps all of the people around you, because if you're protected and a number of people around you are protected as well, then the likelihood of people getting the flu will go down. So, I mean, it also will just save you a lot of testing and worry when you get a flu-like illness this winter. Is it flu or is it COVID? And if you've had a flu vaccine, that's going to significantly improve your chances for, not developing that flu-like illness in the first place. So, all right. Well, that's what I've got for today. If you all have any questions, please drop a note and let me know, and I'll be happy to answer and address them as quickly as I can. And I appreciate your watching, and you all have a very safe and happy Thanksgiving. Take care.